माने हाथ रही
Honorable Provisy has joined, perhaps. Sir? Sir, are you here? Please close your mic. Please close your mic.
Hey,
Sir, you have joined?
Yeah, I have joined.
Sir, good afternoon. Welcome, sir.
Good afternoon.
Good afternoon. Welcome, Dr. Amity University from SPARC-India.
Good afternoon, sir.
Sir, should we start with your permission?
Yeah, definitely.
Anamika?
Yes, sir. A very warm good afternoon to one and all joining us today on this Zoom platform. I welcome you all for the national webinar on mental health issues related to disability, jointly organized by IBAS Lucknow and SPARC-India Lucknow. Myself, Anamika Srivastava, clinical psychologist and assistant professor in Department of Clinical Psychology, IBAS, will be your official host for the event. And I am very thankful to the concerned authorities for considering me worth the opportunity. Quoting Robert M. Hensel, there is no greater disability in society than the inability to see a person as more. Our respected patron, Honorable Pro Vice Chancellor Sir, Professor Dr. Sunil Dhaneshwar Sir, our very respected Chairperson, Director IBAS, Professor Zaidi Sir, our eminent speakers for the day, Dr. Amitabh Mehrotra Sir, Director SPARC-India Lucknow, Dr. Nishant Goyal Sir, Professor of Psychiatry from Central Institute of Psychiatry, Ranchi, and Dr. Madhumita Bhattacharya Ma'am, Assistant Professor of Clinical Psychology, also from Central Institute of Psychiatry, Ranchi, Head of various institutes from Amity University, Lucknow Campus, all the dignitaries, faculty members, and dear colleagues gracing the occasion. Today, we have gathered here to stimulate our brain, refresh our learnings, inculcate required clinical acumen and skills on a very sensitive theme surrounding mental health issues related to disability. We have with us Director SPARC-India Lucknow, Dr. Amitabh Mehrotra Sir. Sir is a PhD in Applied Psychology from Lucknow University and Masters in Social Work from TIS, Mumbai. Sir had a vision to create an environment of inclusion and equal opportunities for all the people with any kind of disability. Keeping his long-term vision in mind, he established SPARC, which is School for Potential Advancement and Restoration of Confidence, India, in 1996, and has been spearheading the movement from the front ever since. Last month only, Government of India has nominated him for a member of National Advisory Committee for Accessible Elections 2024. With this, I would request you, sir, to warmly welcome our very respected patron, Honorable Pro Vice Chancellor, Professor Dr. Sunil Dhaneshwar sir, our very respected Chairperson, sir, our very own Director IBAS, Professor Zaidi sir, our esteemed speakers for the day, and other guests.
धन्यवाद अनामिका जी और मैं हिंदी में बोलूंगा तो कोई दिक्कत नहीं है ना?
नहीं बिल्कुल नहीं।
पहले मैं माननीय आदरणीय प्रो वाइस चांसलर सर को आमंत्रित करता हूं, उनका स्वागत करता हूं कि आपने हमारे आमंत्रण को स्वीकार किया और डॉक्टर जैदी सर ने जो है अपने प्रो वाइस चांसलर सर को जब भेजा तो सर ने तुरंत उसको हामी भरी और आज हम लोग जो स्पार्क इंडिया है वो यहाँ पे आपके साथ है। मैं यूनिवर्सिटी का बहुत धन्यवाद देता हूँ और प्रो वाइस चांसलर सर का, जिन्होंने अपना कीमती समय हम लोगों के लिए निकाला है। मुझे केवल 5 से 7 मिनट बोलना है और मैं 2-3 दिन से काफी मंथन में था कि मेंटल हेल्थ पे क्या बोले, लेकिन फिर ये विचार किया कि मैं एक सेरेब्रल पैलिसी नामक चुनौती से प्रभावित व्यक्ति हूँ, जिसके कारण दोनों हाथों में समस्या और चलने की कठिनाई है। और मैंने जब मेंटल हेल्थ की बात आई तो मैंने कहा कि अपने जो लाइफ की जर्नी है उसको मैं कैसे 5 मिनट में समेट सकता हूँ। तो यहाँ पे मैं यही आपको बताना चाहता हूँ कि हर व्यक्ति की जो जिंदगी है वो एक कहानी है और उसमें सेरेब्रल पैलिसी के होने की वजह से जो है, मैं बचपन में चीजों को इतना नहीं समझ पाया जब तक मुझे ये ज्ञान नहीं हुआ कि मेरे में भी चुनौती है और फैमिली सपोर्ट से उसको मैनेज करता रहा। अपनी डिसेबिलिटी को इतना नहीं जानता था और फॉर्मल स्कूल में मैंने एजुकेशन एक्वायर करी। लखनऊ में महानगर बॉयज हाई स्कूल था उस समय और दोनों हाथों में समस्या होने की वजह से मुझे बोल बोल के लिखवाना पड़ता था और तमाम फेजेस जिसमें मुझे गुजरना पड़ा, क्योंकि इम्पेयरमेंट होने की वजह से मेरे दोस्त नहीं बन पाते थे। मुझे आइसोलेशन में रहना पड़ता था, अकेले रहना पड़ता था और जब मैं एडोलेसेंस एज में था तो मुझे बहुत डिप्रेशन आते थे कि मैं अपनी लाइफ में कुछ कर भी पाऊंगा कि नहीं कर पाऊंगा और हमेशा एक एम्बिवेलेंस था कि मैं कर लूंगा नहीं कर पाऊंगा। फिर जब मैं टाटा इंस्टीट्यूट ऑफ सोशल साइंसेस मुंबई गया, मैंने अपने आप चीजों को लर्न किया। वहां पे जो मेरे क्लासमेट्स थे और टाटा इंस्टीट्यूट में जो स्टूडेंट्स पढ़ते थे, उन सबसे मुझे बहुत सीखने को मिला। कुछ हेल्प करते थे, कुछ हेल्प नहीं करते थे और इन सब तमाम समस्याओं के साथ मुझको जो है आगे बढ़ने में एक मेरी कोशिश रहती थी और पॉजिटिव एनवायरनमेंट जो मुझे टेस्ट में मिला, जो सपोर्ट मिला वहाँ पीयर्स में, हमारी डॉक्टर प्रोफेसर आनमाइटी देसाई डायरेक्टर थी, उन्होंने लाइब्रेरी को भी बोल दिया था कि अमिताभ को अगर नोट्स जेरोक्स कराने हो तो उसको पूरी सपोर्ट मिलना चाहिए। और सभी का एक बहुत पॉजिटिव एटीट्यूड था, जिससे कि धीरे धीरे जो है एक लंबे समय के बाद मैंने स्पार्क इंडिया 96 में एस्टेब्लिश किया और उसमें जब मैंने बहुत सारे चैलेंज लोगों को देखा और विभिन्न प्रकार की गंभीर विकलांगताओं को देखा, तो जो मेरा मेंटल जो स्ट्रेंथ मुझे मिली तो आज ये है कि विकलांगता नीचे हो गई और हम थोड़ा ऊपर हो गए और लाइफ में चैलेंजेस लेने में हमेशा विश्वास किया। तो जो डिसेबिलिटी है वो अब लगता है शायद वरदान है और ये नहीं होती तो शायद स्पार्क इंडिया ना होता और हम लोग विकलांगता के लिए काम भी न करते। इसके लिए मैं वाणी को विराम दे रहा हूँ और प्रोफेसर जैदी सर को भी मैं धन्यवाद दे रहा हूँ कि आपने स्पार्क इंडिया के प्रार्थना को स्वीकार किया। धन्यवाद
सर, हम बहुत शुक्रियामंद हैं आपका कि आपने अपनी जिंदगी में चुनौतियों के बाद भी काफी अपना हमसे शेयर किया और हमें स्फूर्ति और आशा से आगे ले जाने के लिए इसे भर दिया है। Thank you so much, sir, for your warm, delightful, and energetic welcome.
धन्यवाद।
Thank you. I am pleased to call upon today's chairperson, Professor Zaidi Sir, Head of the Department of Clinical Psychology, Director, Amity Institute of Behavioral and Allied Sciences and Amity Institute of Rehabilitation Sciences. Sir is a RCI registered clinical psychologist with more than 43 years of teaching and clinical practice and is trained in CIP, NIMHANS Bangalore and Glasgow, UK. He is recipient of National Award in Empowerment of Persons with Disability, which he had been honored by our very own President, Dr. APJ Abdul Kalam. Sir, may I please call upon you?
Thank you, Anamika. Respected Pro Vice Chancellor, Dr. Dhaneshwar, my dear, very personal friend and colleague, Dr. Nishant, GAIL Professor of Psychiatry, CIP Ranchi, Madhumita Ma'am, Assistant Professor CIP Ranchi, and Dr. Amitabh Malhotra, who is the co-host of this event, the co-event coordinator. Well, a couple of days back when Dr. Amitabh interacted with me, and we had a proposal of organizing some activity over the Disability Day. So we thought that why only one day, why not a couple of days, week rather. And then we thought that one session should also be organized along with other institutes like Institute of Management and Tata Institute Mumbai at Amity Lucknow also. And the different ideas which came in my mind, one was disability and mental health issues. How closely it is, that has already been reflected very personally, first-hand experience of Dr. Amitabh. Once a person gets some impairment, how he feels. Well, the feeling of impairment and associated issues vary from person to person. Disability itself is not a mental illness, but it's definitely a very strong stressor, which might create a problem in otherwise predisposed person. Predisposed person means that the one who has some physiological makeup, mental makeup, childhood experience and all these things, and he might start showing some symptoms. But it's a strong, but it varies from person to person, individual to individual. You have seen that Amitabh ji has overcome, conquered upon and combat with the disability and came stronger and stronger and is becoming stronger and stronger in spite of his limitation of cerebral palsy and continuous barrier and hurdles. When we thought of talking on this, who could be the most relevant and most appropriate and most competent person? I personally know Dr. Nishant as well as Madhumita and every faculty of CIP, because I myself is an alumni of CIP. We requested Nishant, and Nishant was very kind to accept our request on a very, very short notice. And so the Madhumita ma'am. So this seminar, this webinar is basically a sharing of experience and knowledge and some cases which Dr. Nishant and Dr. Madhumita would like to share with you, and to showcase and to sensitize the audience that how the management of disability can be facilitated with the psychological support, and for which I welcome Dr. Nishant and Dr. Madhumita for sharing their experience when they would be requested to. Thank you very much, and over to Anamika.
Thank you so much, sir, for briefing us with the brainstorming evening we are all about to have together today. May I now take an opportunity to invite our Honorable Pro Vice Chancellor, Professor Dr. Sunil Dhaneshwar, sir. Sir has his doctorate in pharmaceutical sciences from Indore University. Our Pro Vice Chancellor, sir, is an eminent scientist and teacher. His richness is experience in the field of pharmacy and pharmacology has been indebatable. Sir has several national and international publications, book chapters, and his international signature in the field. We warmly welcome you, sir, and are blessed to have you leading us.
Thank you, Anamika. And I extend a very warm welcome to Dr. Bhattacharya, Dr. Goyal, and Dr. Mehrotra. And I feel that there cannot have been a better person to speak on this occasion than Dr. Mehrotra. Despite his problems, how he has overcome on them and how he is present amongst us today is a big motivation to everyone who is listening to this program, who is attending this program, that it all ultimately depends on your mental strength and your willpower. I was just reading a article and I came across a very disturbing fact that in US, people with physical disability of any kind are 5 times more prone to mental health issues as compared to others. Now, if you analyze why it could be so, a disability itself is a stressing factor which could lead to a number of other issues. And so mental health or mental issues or mental problems are very likely to be associated with people with disability. And I appreciate SPARC-India for initiating this kind of seminar series. And also I am thankful to Dr. Mehrotra for involving Amity University and our psychology department. I appreciate the initiative taken by Professor Zaidi to host this program along with SPARC-India. And I am very sure that the learned Dr. Goyal and Dr. Bhattacharya will share some very important information as well as tips for our other listeners. And I hope that after attending this very important seminar, those who are attending will be able to help those who need that help. With these words, I express my thanks to everyone present and thank you for calling me.
So, we are humbled and highly grateful to you for gracing the event with your presence, blessing us with your blessings, and officially opening our today's webinar and enlightening us with your inaugural address. And we continue to hope that your words shall be guiding us throughout and pave a way for the continuation of this event throughout. Light, as a symbol of knowledge, removes ignorance and is a lasting wealth by which lots could be achieved. May I now call upon our first speaker of eminence, Dr. Nishant Goyal, sir. Sir specializes in child and adolescent psychiatry, non-invasive brain stimulation, public mental health, and has over 90 plus publications and 20 plus awards and accolades to his credit. May I request you to give your address, sir?
Can you hear me, Anamika?
Yes, sir, I can. We all
Thank you.
can.
So just allow me a moment so that I can share my screen. Can you please confirm if you can see the screen?
Yeah. Please carry on.
So first of all, I would like to thank everyone from Amity University, particularly Zaidi sir, who has been our teacher and has been an alumnus from our own institute, CIP Ranchi. I would like to thank Dr. Mehrotra for bringing all of us together during this very, very important period where we are basically, I would not use the word celebrating, we are recognizing or we are remembering, by this day of disabled individuals. So as all of you know that now we don't call disabled people, we call them specially abled people. And why this is so, I'm sure at the end of my discourse, as well as deliberation by Dr. Madhur Bhattacharya, many people who are actually into this particular field, either suffering from some or the other disability, or who are working with people with disability, will definitely understand that it is wise and better to maintain the dignity of individuals who are suffering from some hardships here and there, to be known as people with special abilities rather than disability. So myself and Madhumita are here to talk to you regarding mental health issues related to disability. In the next 45 minutes or so, we'll take you through the basics of mental health issues related to that disability. I'm sure all of you might be knowing this, or you might agree to this, that how many of us we think that people with psychosocial, intellectual, or cognitive disabilities, they are able to enjoy their rights. We are actually living in a world of righteousness these days. Everyone is, rather than knowing about our responsibilities, we are more concerned about our rights, about our responsibility, not about our responsibilities. So, but when you talk about your rights, how many of us we actually think that people with any disability associated with their psychosocial factors, either they're marginalized people, they're intellectually disabled people, or cognitively disabled people, they are able to enjoy their rights? And how often these people are perceived by society? I'm sure you must have seen someone around you who is suffering from visual impairment or locomotor impairment, and maybe acid attack victims, acid attack survivors. So how do you actually look upon them? You look upon them, with the sense of disgust, or you look upon them with the sense of pity, sympathy. So all these things are extremely important when we are actually talking about disability. Now, I'm sure we all understand this particular thing, that people with visible disabilities, what you can see, they definitely experience different types of discrimination when they're out in public, as I was just talking about. You'll definitely see that in the workplace, the misconception that a person you are hiring with a disability would require prohibitively expensive accommodations, or you need to give them this or that. I'm sure all of us will agree to the fact that a person whom we know that is suffering from some disability, we take a while and try to see whether how do we not employ them. So they are subjected to workplace discrimination. There is enough evidence which suggests that people with disability are at an increased risk for suicide or suicidal ideation. I'm just giving you this most serious discourse about mental health issues. People are, and I think our Pro Vice Chancellor sir was also telling that people are more than 5 times at risk of suffering from mental illnesses who are suffering from any disability. So, and it is not that disability which is leading to suicide. It is basically the discrimination what they're facing, or the discontentment what they're facing because of their issues, which leads to doing all these things. So we all know that WHO's Global Burden of Disease study in 2017, it mentioned that mental health disorders are the second largest source of burden in terms of YLDs. I'm sure most of you know what is years lived with disability. And they projected that 2020 depression will become the second largest, disease in terms of non-communicable disease after cardiac diseases. And we have already passed 2020. And COVID has actually taught us the importance of mental health in our lives. पहले हम लोग सब पागल पागल बोलते थे, अब everyone is aware of the fact that there is something called anxiety, something called depression, something called restlessness. We also did a survey, which was actually CIP Ranchi was part of the National Mental Health Survey 2015-16, where we found that people in the age of 40 to 49 were the most affected individuals by psychotic disorders, mood disorders, depression, so on and so forth. I'm sure most of you know the concept of disability. So what is a disease? What is a disorder? How a disease or a disorder, when it is affecting the body, causes impairment, leading to disability in an individual and causing a handicap. So it is not that any illness or any disorder is affecting the individual. It is affecting the individual in body, in mind, as well as also affecting the society. So as for WHO, disability has been now further classified or further understood in terms of impairment in doing any activities of daily living or activities which are required for that particular individual, leading to limitations. And because of that impairment, the person is not able to participate in various societal activities, individual activities, family related matters, so on and so forth. So I'll not go into the details of this particular concept of disability. I've already talked to you about this. Now coming to the evolution of concept of disability affairs, how and I must tell you, we have traveled a long way from moralistic society to righteous society, again going back to moralistic societies. In 1950s, the UN Social Commission first agreed on the need to establish international standards for education, treatment, training, and placement of persons with disabilities. I'll use the acronym PWD, for the sake of time. Again, in mid 1970s, a right-based perspective on disability was talked about at the level of United Nations. In 1971, the first declaration on the rights of mentally retarded individuals was made. Then, as I said, the declaration was made for the rights of differently abled person. 1981 was announced as the International Year for Differently Abled Individual. And I'll just move on to 2006. Now, 2006 was the very important period. It was, the time when the entire concept of persons with disability changed. And that was the reason why Government of India was also forced to relook the Act of Persons with Disability. So what was that? That was the signing of UN Convention on the Rights of Persons with Disability, that is commonly known as UNCRPD. And India was one of the countries which has signed this particular treaty. Now coming to the evolution of disability affairs in our country, Rehabilitation Council of India was born in 1992. The Persons with Disability Act was made in 1995. After the ratification of 2006 UNCRPD, government started to develop a new act which was known as the Right of Persons with Disability Act, or the RPWD Act of 2016, which has been enacted now, and we are going on. National Trust Act was also developed in 1999. So these are some important landmarks when it comes to disability related affairs in our country. Now, as I was telling you, this UNCRPD was a landmark event in the history of disability in the world by the fact that the purpose of entire convention was to promote, protect, and ensure the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disability. Mind it, each and every word is important in this particular purpose or purpose statement. Promotion, protection, surety, complete, equal. So, and the human rights and the fundamental freedoms of all the persons with disability, and at the same time to promote respect for their inherent dignity. So this is the basic convention which talked about the rights of persons with disability. So this led to a paradigm shift from seeing PWDs as objects of charity, medical treatment, and social treatment, which was happening for many years and decades, to people seen with persons with rights, who are able to claim these rights, making decisions of their lives based on their free and informed consent, as well as being active members of the society. So social inclusion became a very important part of the rights and dignity of persons with disability. And that is how RPWD Act came. And initially in the old PWD Act of 1995, handful of illnesses were included in the disability. In the RPWD Act, now we have more than 21 disabilities are included. You can see the picture. I'll not read them one by one, but in terms of mental health or mental illnesses, point number 6, 7, 9, that is intellectual disability. Mind it, how things change. Initially, any person who was suffering from low IQ was called a person with mental retardation. Now the term mental retardation has been changed. Now it is called intellectual disability disorder. So how the righteousness of PWDs change the entire definition of intellectual disability. All mental illnesses, they are included under the RPWD Act, including SLDs, people suffering from language disability, speech disabilities. I'm sorry, acid attack but it has also been included in disability. So as I was telling you, after ratification of the UNCRPD, RPWD Act was formed. There are 102 sections spread across 17 chapters. And as I just mentioned, there's the schedule and definitions of these 21 conditions recognized as specific disability. So three types of, or the continuum of disability is envisaged as three. Now, a person with disability who has a long-term physical, mental, intellectual, or sensory impairment, which in interaction with the barriers hinders its effective and full participation in the society with as equal as others. Then another continuum is the benchmark disability, a person where there is no less than 40% of a specific disability. So the disability has to be more than 40%. Then only, and when you say 40%, the disability has to be measured. So that led to development of some tools, as well as use of those tools, and a proper authority which can actually certify that a person is having more than benchmark disability. And any disabled person with benchmark disability who require guardianship or support, they come under this category of high support need. So all these categories are extremely important. Disability with high support need is more important for mental health related disabilities, and it is included in the section 14 of the Act. So as I was mentioning, what I think many people are actually playing with the screens. So if they can just, I don't know, someone is just playing with the screen. So it is creating some hindrance if it can be taken care of. So the salient features of RPWD Act include rights and entitlements of persons with disability, the principles, the schedule, provisions for persons with benchmark disability, guardianship, authorities are established, and people who are they are under contravention of the law, the offenses and penalties have been described. Now let us try to understand the issues, particularly mental health issues faced by persons with disability. This particular report by CDC in USA, they mention that adults with disability, any disability, they report experiencing more mental distress. As Sir was mentioning, around 5 times higher. They say that uh, out of those 30 days, 14 days are wasted because of mental health related issues in these individual. People with disability, they are vulnerable for abuse and violence. Every day, when you switch on your TV or open the newspaper, you will hear or listen or read the news that a person मानसिक रूप से या शारीरिक रूप से विक्षिप्त आदमी के साथ लोगों ने गलत काम किया है. So abuse and violence go hand in hand. People who are suffering from disability, they are at a greater risk for this, and this is called victimization. And victimization is harm which is caused by or for a purpose. This includes physical violence, sexual violence, emotional abuse, even verbal attack or not taking care of them are also amounting to abuse. As I said, neglecting the personal needs for daily life also comes under abuse or violence in relation to people with disability. All this leads to isolation, stigma, stress, and depression. So the psychological aspects of illness and disability, they have various dimensions. I'm sure all of you are aware of physical dimension. There's something called emotional dimension, where mood, the way you handle things on a day-to-day basis gets affected. There is an intellectual dimension where people use their cognitive abilities to take care of the activities of daily living. There is an environmental dimension. All these come under the psychological aspect of disability. The environmental dimension basically talks about how our environment is conducive or how we are taking care of ourselves in a particular environment. Then the socio-cultural dimension, how we interact with people, how we will meet with people, and finally the spiritual dimension. So I'll not go into the details of this particular aspect. I'll directly come to disability and mental health. Mental health and disability, they are like same coin ke do side, like two sides of the same coin. Mental health or mental illness can lead to disability, and any major disability, including physical disability, local disability, can lead to mental health issues. So they go hand in gloves with each other. So first we'll talk about like what are the major illnesses which are causing disability. Just talking about the disability certification procedure, I will not go into the details of this. So any Indian nation can give an application for disability certificate by providing a proof of residence and a photograph. An assessment is done, and depending upon the types of and the number of disabilities, a certificate is issued by a certifying authority. If anyone is interested, we can talk about it some other time. So coming to intellectual disability, as I was saying, mental retardation has now been renamed as intellectual disability. In intellectual disability, certification can be done from age of 1 year and above. Up to 5 years of age, we don't call it intellectual disability, we call it global developmental delay. The certificate can be issued as intellectual disability at 5 years, and it should be renewed at 10 and 18 years. Unlike most of the specified disability, once a person is categorized under intellectual disability, the person has to have a basic or a minimum disability of 40%, which we call as benchmark disability. The tools, Madhumita will talk more about it, are Vineland Social Maturity Scale, then Mullin's Intelligence Scale for Indian Children, so on, so forth. Now coming to specific learning disability, then SLD again is a very, very important area, particularly when it comes to academic difficulties and other things. In SLD, the first assessment is recommended at the age of 8 years or the 3rd grade. And again, it is repeated for the purpose of evaluation certification 14 and 18 years. So ideally, the teachers should carry out screening at 3rd grade or the age of 8 years, whichever is earlier, in people who are or children who are suffering from consistent academic problems. ये बहुत important है. Just because हमें करना है doesn't mean that every child is subjected to an assessment. Any child having consistently problems with related to academics should be taken into consideration. So we can do IQ assessment. I think the tool which is used for defining the benchmark disability in SLD is the NIMHANS battery for SLD. Similarly, for autism spectrum disorder, we use a lot of tools like ESA, which has been Indian Scale for Assessment of Autism, which has been mentioned under the Revised Person with Disability Act of 2016. Now, mental illness. As I said, mental illness itself can cause disability. So whenever we talk about certifying disability due to mental illness, we have to first verify the clinical records and diagnosis. There is a tool. Madhumita will give you more details about this tool. This is called IDEAS, or Indian Disability Evaluation Assessment Scale. Then we also assess comorbid intellectual disability, and if we have a score of benchmark disability of more than 40%, a person can be issued, the disability certificate. What do we know about the impact of psychiatric comorbidity in persons with disability? ऐसा नहीं ना है कि प्रॉब्लम लोगों को ही हो रही है, but at the same time, people with disability when suffer from psychiatric problems or vice versa, it increases the healthcare utilization and cost. The staffing pattern, level of support has increases. The role of police comes into picture. Placements become a problem. There is increased likelihood of people admitting to a psychiatric institute or a hospital. When you are giving them multiple medications, there are chances of complications associated with that also. And if a person suffers from medical problem, it again further complicates the thing. So I'll not go into the details of this. I think Madhumita will talk about ideas and all. So I'll just go back to the previous slide. Yeah. So as I was telling you, with RPWD Act and ratification of UNCRPD, initially what we used to do, suppose previously we would call places where people were kept isolated were behavioral homes. Now we are going towards recovery model, and now we are talking about culture of care living with homes. So holistic treatments are individualized to a particular person. We go for symptom focused treatment. We go for positive behavior support. I'm sure Madhumita will give you some more details about this. So with this, I'll stop my screen share over here, and I'll request Madhumita to take it further, particularly about assessment and management of people who are suffering from mental illnesses with disabilities. So I'm stopping my screen share. Over to you, Madhumita. Or over to you, Anamika, if you can introduce Madhumita further.
Yes, sir, sure. Sir, thank you so much for enlightening us with the talk of the day. We have understood this by touching upon the concepts of disability, landmark events, both globally and in Indian scenario, right from 1950s till 2016, from the UN, where UN first took the initiative, till we followed it through with RPWD Act of 2016. We also talked about the dimensions of illness and disability along with the best practices of the recovery model. Thank you, sir, for your rekining us with the impactful words. Your words hold immense significance for the theme of this webinar. I would now request our yet another speaker of eminence, Dr. Madhumita Bhattacharya ma'am, to further submerge this academically fulfilling evening more into her learnings and clinical insight. Ma'am is having a doctorate in clinical psychology, also from CIP, which is Central Institute of Psychiatry in Ranchi, with research interest areas in clinical psychology, addiction, and neuropsychology. We warmly welcome you, ma'am. Ma'am, are you there with us?
Yes. Over to you, Dr. Madhumita. Mic बंद
You
है
have to unmute yourself, Madhumita. You have to unmute yourself. Madhumita, please unmute yourself. Can you hear us? Madhumita, can you hear us? I think she is not able to. Let me just speak to her. Give me a moment, sir.
Yeah.
Sure, sir, sure.
Madhu, yeah, yeah, but we are not able to like listen to you. Unmute yourself. Unmute yourself. हाँ एक बार rejoin करो. एक बार rejoin करो. हाँ. I think Madhumita has some issues in terms of getting unmuted. So if the host can unmute her, maybe.
Sure, sir. I'm doing it.
Yeah, I think she's
Yeah,
there.
hi.
She's okay.
Hello.
Yeah, yeah.
Uh, Good evening, all. I want to thank all of you. I will not take much of your time and straight away start my screen sharing. Just give me a moment.
Oh.
Madhumita, are you facing any issue in terms of sharing your screen? Madhumita?
Yes, sir.
Are you having any
Yes.
difficulty sharing your screen?
Yes, I'm not getting. Yes, I got it, sir. Just a minute. Is my screen visible?
Your screen is visible, but the PPT is not visible. You have to open the PPT, Baba. Yeah.
Sir,
Just
Yes.
do the slideshow.
yes.
Yes, now it's fine.
So sir has already talked about that how what are the issues that generally faced by any individual with disability, and that can be any kind of disability that we are talking about. Now, when we talk about disability assessment, we see that the overall functioning and how the current functioning of the person, and how the person has been functioning for some period of time, or the period of the disability. So that's how we give them scores, and there are often a time when we try to see if there is any kind of intellectual disability, because this intellectual disability can be very, very common in case of any other mental illness or any other physical illness. So chronic suffering from any other mental illness, I'm not saying that that can lead to intellectual disability, but that actually affects the overall socio-functional, social functional, occupational scenario of the person. So now, at least the aim of our today's talk is basically we try to find out some kind of measures that what any person with disability who face any kind of mental issues can do. So first of all, as a society, we all have to accept that they are not disabled, they are having disability, and that can create a difficulty for them. So they are specially abled people, and that's how sir has already been talked about, that we have moved upon already, and but as a society, as a whole, we need to accept this fact, and that's how we need to include people as they are. These are some statements I have taken from different people who has any kind of disability, and they have said in different ways, as you are seeing, that there are a lot of problems. Even if we are talking about rights today, even if we are talking about inclusive education, inclusive placement, there are a lot of physical facilities, that equipment related facilities that they should get as a right in their workplaces and many other places, but still the discrimination remains. And so people are saying that how they are getting bullied in school or maybe in college, or they feel any kind of isolation in their workplaces, and so there so these remains as a challenge with them, and that may create a lot of distress. So they can face any kind of problem in case of their education, and any workplace, and followed by this, there is definitely lack of security, as sir has already said, that if the discrimination remains, then there will be lack of security, there will be lack of confidence in them, and the feeling of worthlessness, isolation. So those all rejection, these kind of things will be there, and which will lead to their um, a lot more impairment in the socio-cultural scenario. So as we are seeing in this slide, that disability has been understood as resulting from any kind of impairment. However, it is now definitely understood, but it is probably not in our behavior that we have started imparting in, right? That every people, they have their own rights, and they should be able to exercise those rights. At least as a society, we need to be much more amenable in that. So now, considering the situations, these all are current situation, how if we see a person, a young woman with a wheelchair, how a kind of a first of all our reaction comes, how we become, very prompt to show pity to her, or maybe, we immediately try to say that, these are the remedies, why can't you go this and that and this kind of things. And so that's how we sort of, as a person and, citizens of the society, we sort of try to give them, become judgmental, and, we give them a lot of suggestions and things like that. If we see again a person with a diagnosis of schizophrenia, which is considered to be a mental illness, where we become very much, we feel that this person will not be able to, be included in any kind of work or anything. We again becomes kind of a judgmental for them, and why we just give them suggestions that, this should be told to the employer, or, you need to do this and that. So this kind of situations, happens. Now the scenario is that if it is a very much visible problem, a very much known problem, or a long-term problem, that these discriminations, this attitude of the society definitely becomes very much chronic for them, right? So this Center for Disease Control and Prevention, they are saying that 17.4 million people worldwide, they experience frequent mental illness, or at least mental distress, because of this frequent discrimination and non-inclusive culture that we, impart toward them, right? So, if we see any child with any kind of disability, so how we can go ahead to approach? We can actually, see that what are the early childhood interventions available, what are the, ability that the child has, and what are the deficits that the child has, and how that can be, modified or maybe trained with some kind of skill training, right? So the settings will be, multiple settings. So the hospitals, the early intervention centers, the community centers or Anganwadi centers, the definitely the home atmosphere, schools, everywhere the child should be able to access those, help, uh, that the child needs to have, right? So, and there lies a kind of a community-based approach. So when we are talking about rights, if the person has to enjoy, or I should not use the word enjoy, if the person has to exercise the right, then, society at large, we also need to be aware about those rights, and we need to be, more amenable as a, co-citizen, to be, to be able to give them that space, that so that, they also can exercise their rights. So their rights definitely includes all those things, that, they, how they can be included, how they can be facilitated. Not only, there are some ramps or, other, uh, uh, physical properties that needs to be included. So the way we talk, the way this particular child or an individual needs those interventions, those needs to be available in all those, part of the society. Definitely, a family as a whole also, if has any kind of child or any individual who is suffering from who is having some special need, definitely also needs some kind of support. Other than this, that family also will not be able to function properly. So basically, health, education, livelihood, and socio-cultural milieu, everything needs to be, very much inclusive, and promoting the facilitations that the individual needs, so that, we can the rights we are now talking about, the person will be able to avail and exercise those rights and then can be empowered. So, yes, we are talking about benchmark disability, but the thing is that there is, a lot of discrimination when it happens that a person with have lot of visible disabilities, right? So, the thing is that then, we may talk about those disability rights and maybe a lot of wheelchairs, hearing aids, walking sticks and all those things. But remember, there they face a lot of discrimination. So the thing is that if a person needs some aids, we need to be able to communicate that the person needs to able to communicate that need. So if I have some issues with my eyesight, I avail a spectacle, right? And if I need my spectacle, I need to be able to communicate that need. So this is how any person who is having any kind of special need should be able to communicate that need. This is how the society needs to be more inclusive. So, as you're saying that that is how it is called rehabilitation, that they need some extra support and how we are being able to provide them those supports the way they need, a child with learning disability or maybe an adult with learning disability may need some remedial measures, I remember when an adult came to us with some other issues, some other distress, we found out that he's facing that distress from quite some time from his early childhood because of the reason. One of the reason was that he had learning disability and he was diagnosed having learning disability at quite elder age. So maybe a lot of interventions we may not be able to do with him or her, but at least some modifications in the environment we make. So what modifications we made was that point of time we asked him that you keep a blue paper on the book. So the books are basically white and black background, so the black words are very much confusing and jumbled up for him. He cannot read those things properly or at one go. After giving this simple modification, he started doing it and he started taking interest into further remedial measures. So that's how we can make small modifications for people definitely depending on their needs. So that's how, we need to incorporate those mindsets so that we can help them. Now, what else also we can do? Definitely movement is the key. I know that there are a lot of people who have, who will be saying that people, in the wheelchair, how they can, move. But there are a lot of options available for them as well. There are wheelchair yogas, wheelchair basketball, and, even very fast movement with the wheelchairs also, can count as movements and that also benefit, because the thing is that always, even sitting in the wheelchair working with resistance bands also count as movements, and those movements definitely will help in their better well-being. Because the reason is that inactivity is never appreciated. Some activity is definitely better than no activity. So that's how we need to promote more physical activity depending on the person's ability, and but we need to always motivate them in order to be more active physically, so that they can have more happy hormones, and that can help them to deal with the stressors that they often face. That's how. So we need to really work on their self-efficacies, their how they can solve their problems, the specific problem-solving strategies, and how they can be more. The strategies can be more problem-focused rather than emotion-focused. So that when we face any problem in our life, we may become, while solving those problems, we may start seeing from our very much emotional angle, and that makes the situation even more difficult. So how those things can be done, decision making, problem solving, these all are executive functions. So we may need to teach them those skills as well, good coping skills, so that, we can make them more resilient, in order to uh, deal with all those problems that they face. So finding engagement and purpose are essential in overcoming isolation and depression, combating depression. So depression or any kind of stress that the person is facing, we may, apart from physical activity, yoga, breathing exercise, meditation, and any other mindfulness based exercises, we can always teach them that, how you can engage with people, how you can regularly try to be in touch with your, schoolmates, maybe college mates, or maybe anybody, that, you have good wavelength match with those people, and finding the values of your life, how you wanted to, be remembered, how you want to be remembered, and what are the steps that you can, take for that. So these are very simple acceptance and commitment therapy act-based, interventions that we can always teach uh, people who are in stress. So if I, definitely want to conclude, I will say that definitely, these all are, there is a significant connection between any kind of disability and mental health or mental health related issues. But that connection is far more complex than, it is seeming right now. It's rarely about the illness or injury itself, but when a person feels alone in one place where, he or she is in need, uh, and the social and ideological barriers that make this full engagement in our communities so difficult. So it's about having to fight for opportunities that non-disabled persons may take for granted, but the result is rich, full, and joyous life alongside of your challenges. It just means you may need to take some special care, seek support whenever you need. But as a society and people who claims, ourselves who claims that we are non-disabled, maybe, apparently abled people like us needs to be change our mindset, and we need to be more amenable to provide those supports, to be aware about those supports, so that we can make the other person who is in need, to make them aware, so that they can avail those supports and intervention that they require to. So let us, not deprive any person, for their life that they want and they deserve. To achieve it, though, they may need some specialized support. So that's how we can make these things more inclusive and amenable. Thank you so much for giving me this opportunity.
Thank you so much, ma'am, for describing to us various procedures to aid not only in understanding of cases, but also in planning the intervention, rehabilitation, or even the certification purposes as well, thereby considering various demographic variables like age, culture that you have described, and that too with emphasis on the multidisciplinary approach. We are grateful to our speakers for their arduous work to contribute towards making this event a fruitful endeavor. Every end is a new beginning. There can be no better way of approaching the end of this intellectually enriching evening than to invite the chairperson of the webinar, Professor Zaidi Sir, Head of the Department of Clinical Psychology and Director, Amity Institute of Rehabilitation Sciences, to make a concluding remark and address to any queries that our participants might have. So,
Thank you, Anamika ma'am. Thank you very much. Thanks, learned speakers and Professor Sunil Daneshwar sir, Vice Chancellor, that he is with us all through in spite of his very busy schedule, and he has to proceed on official visit to Trivandrum also day after, today and tomorrow and day after. So you can imagine that how busy he would be, but this shows his interest towards the community and towards the welfare of the persons with disability and the persons who needs a real support. Before I try to conclude it, I would expect and I would request audience to, if they have any query, and there are 8 points in the chat. Namika ma'am, can you read and if you can ask the question if there is any, so that the learned speaker can solve their issues. First of all, that if there is any
and I
question.
am reading the chat. It is majorly about introduction and thanking of the speakers. No more questions as of now. Yes, sir.
Okay, fine. It means that the presentation was so clear that it reached to the audience and audience are fully satisfied. Congratulations, Dr. Nishant as well as Dr. Madhumita. Well, both the learned speakers have given the very wide coverage of every aspect, starting with the legal issues, the historical backgrounds, the medical issues, rehabilitation issues, and all these things. Nothing much to add except few things which I would remind you, and I think Nishant as well as Madhumita will agree with me, that which I started in the beginning itself, that disability itself is not the mental illness, but it is a very, very strong stressors which might trigger some manifestation of problems of emotional nature, thinking process. Please close your mic, which would directly related to the disability, as well the severity will depend upon person to person, his perception, his resilience and all this. So it shows that we have to work from the very childhood, from the very beginning. We talk a lot about our physical hygiene and the health hygiene, that where we give all type of immunizations and the nutrition and all these things to combat with physical stresses, but not much are given to meet out the psychological stresses, which is the reality, which is going to happen in any forms. COVID was one of them. It was not a disabling condition for many, but the resilience was very serious, and the people are still suffering from the setback. Fortunately, only 5 or 6% of people suffered from the COVID symptoms, but 100% people are suffered from the psychiatric or the psychological emotional setback. So we have to, first of the biggest message is that we have to develop resilience for any eventualities, for any impairment, which is the reality of life. The second thing is that we have seen many disability which is quite obvious, which is visible, and the reactions to this is quite obvious. But there are many conditions which are not visible, like borderline cases, like low delayed learning process, low intellectual levels, borderline cases, low hard of hearings, myopia, not diagnosable for labeling a person, but the suffering of person, the psychological setback of the persons are sometimes even more severe than the obvious disability, because they have the limitation of not disclosure of it. I mean, they don't want to share with anybody that what problem they are facing, what type of things. Hard of hearing persons are for low vision cases, are for borderline cases of intelligence. How to explain and how to understand, this remains a problem for borderline cases. How to understand and how to explain, and that makes the person very, very upset and requires a definite psychological support. non-disclosures of their inner feelings. There are many persons who are having one type of obsession or the other, one type of doubts, curiosity, and uncertainty or the others, but they are not disclosing. They are not disclosing, and that is further leading to their employment issues and the adjustment issues and the problem with everyday life. So this is another issue which might blood-related issues. I mean, hemophilia is one of such. It is a latent, it is hidden disability. But the person, the boy, the child who has developed this hemophilic are the parents of them would all the time stress that how to survive, how to prolong, how to play, how to enjoy, how to pass a leisure time activity, because even the slightest hurt to the body may lead to the very serious bleeding and may lead to any serious crisis. So these are many such issues which might cause still further psychological complications and unaddressed complications. So social attitude of society and biasness. I mean, even if you want to disclose things, even if you want to take the advantage of various facilities given, the society would definitely react to this, and you would feel isolated, you would feel rejected, dejected. First rejected, subsequently dejected. Other day, our Honorable Pro Vice Chancellor was given a very apt example that we don't mind putting the chashma, but if you ask anybody to put the hearing aid, he will avoid, because chashma has become the part of your body, but the hearing aid is still taken as very strange thing, and people would not feel comfortable. Their body image, their self-image would be spoiled. And in spite of that, even right now, I am putting hearing aid for getting the voice right from the computer to clearly. And after using of the mobile and all these things, this hearing aid has become the earphone. That is the only difference, but it is used. But if you do not have any such thing, and the reaction to this, so this type of prejudices, this type of problems, biasness is further creating. Once you meet with an accident, you are not worried about you have lost your this and that. Your biggest question is कि अब क्या होगा हमारा, and we are living in the vertical society. We are concerned for our parents, we are concerned for ourselves, we are concerned for our children. And this vertical society, living vertical society, is creating further more emotional problems if something has happened. So if social security scheme, social security is given some extra importance to it, though on paper scheme is there, but how nominal the budgets, how nominal the provision is there, that you all know with it. We are the country of acts and policies, very, very good policies, but implementation, it is always a question. Dr. Nishant has given the historical background of so many acts, so many provisions, but most of the provisions prior to enactment of a right of person with disability, it was all on the provision basis as far as possible. The very act used to read as far as possible. And the employer and the government used to jhado their daman by saying it is not possible. And there was no penal action on this, because the very act was speaking as far as possible. The government or the department or the employer will provide these things. But now it is not a charity, it is not the convenience of the department, it's not the convenience of an individual. It is the right of the person, and if you are not providing this thing, you are doing the violation of human rights. So now situation is improving, and the government is also, and NGOs and everybody is working on this line. But in spite of this, I'll say that, and would agree with me, that in social sector, there had been a lot of development and progress and achievements in different sectors, medical sectors, engineering sectors, commercial sector, and all these things. If in social sector, if something is very, very prominent, which we have achieved last 20 years, is the awareness about the disability and the concern about the disability. And this is the good beginning. And I do hope, I have full reason to hope that the next generation, the people would be having their rights, and the reactions would be comparatively nominal, and they would be able to share their feelings. And the culture of counseling has to be developed. very, very unusual situation that we have family experts of everything, including family tailor, a family dhobi, and family cook, but we do not have a family counselor. We do not have family psychiatrist. We do not have family psychologist, because we are not agreeing, we are not accepting the reality that everybody needs some support, some emotional support, and some person to speak about it. And that is why there was some references of high suicidal risk and all these things. Suicidal risk is because that we do not have, if you get the opportunity to speak, lot of catharsis will take place and lot of things would be resolved. But it is not in practice. So I would very strongly recommend that we should promote, we should motivate people to speak out, to talk to them, to consult the counselor, the psychiatrist and clinical psychologist, and everyone who has a direct professional competency to give the support. With this, I would say extremely good, a useful evening, and Pravisi is still here, and I'm very thankful to you, sir. And I will request you to give your concluding remark on this session, sir. Thank you, sir.
Thank you very much. And I once again, Dr. Mehrotra, Dr. Goyal, Dr. Bhattacharya for sparing their time and be with us and sharing very important information with all of us. I am very sure that the audience must have been benefited with this. And I hope that Professor Zaidi and Dr. Mehrotra in future also will organize many such programs together. Thank you so much.
Right.
Sir,
Thank
I
you so
speak
much.
for 2 minutes?
Sure, sir.
Sure, sure.
Thank you. First of all, because I was given an opportunity to join hands with Amity, so my sincere thanks to our respected Vice Chancellor, sir, who has been throughout the program, sitting with us, guiding us, and opening more avenues to work together in future. That is, sir, I must sincerely thank you. And I am also grateful to Professor Zaidi for providing encouragement and real opportunity where he managed everything. And yesterday we were joking also on the mobile. So, sir, my thanks to you. And also, I would like to thank Dr. Rishan Goyalji and Professor Madhumita ji for giving very wonderful and very apt deliberations, which has given a lot of encouragement. And we have to see, like the SPARC-India, like I don't consider myself to be a person with disability because I am the soul. This body will go away, but the soul, I made my own impairment as my strength. I will not mind saying it is, I have done some compensation or alternative something I took. I made it. मैंने अपने इसको जो है मजबूती बनाया. So the thing is, the answer, your university has started with a special education cell, and there is a society adapt in Mumbai which have approached us, and we are the fourth of their regional partner. They want to put up a hub where we can impart trainings and develop things for our state and at the national level. So not because their time is valuable, I respect that. And Madam Anamika, who spoke so well and kept the movie spirit alive. Well, last, sir, please accept my thanks and regards to you.
Thank you. Over to
Thank you so much.
Ayushi for the formal vote of thanks from university. Please, please, बंद करें अपना मोबाइल. बंद
Thank-
कीजिए, please.
I thank Amity Institute of Behavioral and Allied Sciences, University, Lucknow Campus, and SPARC-India for giving me the opportunity to express my gratitude. I express my sincere regards to our patron, Pro Vice Chancellor, Professor Dr. Sunil Dhaneshwar Sir, for inaugurating the webinar and blessing us by his gracious presence and his words of wisdom. I extend my deep sense of gratitude towards our eminent speakers, Dr. Ishan Goyal and Dr. Madhumita Bhattacharya, for enlightening us with their expert knowledge and experience. I would extend my humble gratitude towards the founder director of SPARC-India, Dr. Amitabh Mehrotra, and his team for his contribution in organizing the webinar jointly. I express my warm regards towards our chairperson of the webinar, Professor S.Z.H. Zaidi, for eloquently moderating and concluding the session. I would also like to thank my colleagues, Ms. Anamika Srivastava, for hosting the webinar flawlessly, and Mr. Sajid Kazmi for always being humble and prompt, extending a warm helping hand. I would also like to extend a warm thanks to all my learned colleagues of IVAS for being a constant support. Lastly, I would like to thank the participants of the webinar for being patient listeners. Thank you, everybody. Have a great evening.
Thank you, sir.
Thank you for concluding the day with that humble words. Remarkably successful event with enriching inputs by all our dignitaries, insightful experienced speakers, and the wonderful participation. I am sure we all are fulfilling time both as academicians and as nations. On behalf of India now, Lucknow Campus, I sincerely hope that each one of us continue our efforts to create a positive Indian campus and serve our
Connectivity, some connectivity issues there. Anamika, connectivity issues are there with you. Voice is not clear, breaking.
Sir, am I audible now?
It's okay, you are, but voice is breaking, continuously voice is breaking, it's fine. I mean, thank you, sir, thank you. I think now.
I sincerely hope it will. Have a wonderful day, everybody. Thank you.
Thank you so much.
Thank you. Dr. Nishan, thank you very much. I think he has left, he has gone. Madhumita. Thank you, sir. Thank you very much.
Thank you, sir.
Right, sir. Thank you.
Thank you so much, sir. My
Thank you.
gratitude for
Madhu, how are you? Thank you very much. It was a great presentation. Convey my regards to everybody there.
yours.
CAP.